I've got two new guests with me. We've got Adnan and we've got Ilyas.
Hi everyone. Hello. This is Ilyas.
As you can see, it's going to be absolutely fantastic for 2025. We've got a lot happening for you folks. So I want you guys to get very buckled down. 2025 is going to be a great year. And in this video, and I don't know why Nam making noise, but in this video we are going to be focusing on the Royal Pharmaceutical Society framework for prescribers. So join me. Right, okay, so Ilyas, come here. Very, very important that he can explain this to us. I really want Ilyas to have a great understanding of this competency framework. Now, we're going to pretend that Ilyas is going to do his prescribing course. So he's going to be a pretending pharmacist, and we are going to explain to him exactly what's happening here. So you don't know anything. You don't have to know anything. I will ask you questions, and whatever you think is right, you tell me, and then I'll explain to you exactly what this is. First of all, this framework is designed for anybody who wants to prescribe, not just a pharmacist. It's designed for doctors, it's designed for pharmacists, it's designed for nurses, it's designed for anybody who wants to prescribe. So if you can legally prescribe, then you have to follow this framework. First of all, Ilyas, and you don't have to know the answer. When I say the word framework, what does it mean to you?
It's a pattern of a step-by-step process.
Okay, I'm impressed. I actually thought that he didn't know this. I swear. The reason I asked him was I actually thought he wouldn't know this, but he's right. A framework can be thought of it's like a overarching set of rules or procedures or process, like he's saying. That's what it is. What it was is, if you've got a doctor prescribing, a pharmacist prescribing, let's say Teja's a nurse prescribing, let's say we have Adnan, a physio prescribing, how do we make sure that we all are meeting the same standards? That's where they designed this. That they said, okay, if you're going to be a prescriber, then the set of processes, principles or standards in here have to be maintained by everybody, irrespective of your profession, because if you're going to be prescribing, you've got to be at that level. Okay, that's the first thing. Right, good. Ilyas is looking good. He's looking in good shape, which is great. To be honest, it's his first time in front of camera, so I'm quite impressed. I'm quite impressed that he's actually doing quite well. When it was my first time, I was literally like this. Hi, my name is Fahim. That's how I was. So I know what he's going through. It's not easy, but he's smiling, he's making eye contact, he's doing absolutely well.
Maybe you can introduce yourself. So,
as I told you that I'm Ilyas, I'm working at Medlearn. I'm the student mentor who helps the student to find the university, to find the DPP.
I think that was too quick. That was too fast. So next time he's got to be slower. I think that was just rattled off. So while I get this prepared, Ilyas, introduce yourself again before we get into this video.
Alright, myself Mohammad Ilyas, and I'm working at the Medlearn, and I'm the student mentor who helps the student to find the universities, to find the DPPs, and who helps to find the student in the local areas to find the university.
Basically, he does everything that I ask him to do. That's what Ilyas does. Anything that I'm struggling with, Ilyas does. And we've got someone at the back, Priya, as well, who's a bit shy to come on camera. I don't know why. She's there doing something. Is she not there? She's a bit shy. I think she's in the other room, but she's a bit shy. Let's show what Priya is actually doing. Let's show you our Medlearn team. And she might try to run, but we're going to see what she's up to. And look, she's actually not here. She's actually not here. She disappeared. She's actually out of the room. Anyway, she disappeared out of the room. Doesn't matter. She's actually ran away and disappeared out of the room. Anyway, let's bring it back. Let's bring back the focus. So, this framework. First of all, what you have is they divide this framework into two major sections or domains. The first section is the consultation. The second section is prescribing governance. What does governance mean to you? The word governance.
Rules made by the government.
Okay, good attempt, because the word governance, he's linked with government. Not exactly what we're thinking here. Any ideas, Adnan, what you think? Governance?
just the management of how you're going to follow the rules.
Correct. So governance can be thought of as the processes in place to make sure that everything's happening the way it should. That's what governance is. Simple as that. It's just making sure that actually what's supposed to happen is happening, because ultimately they are looking to become prescribers. That means that they're going to prescribe. So how do we make sure that they're prescribing safely? How do we make sure that they're prescribing in accordance with the law? How do we make sure that these people are trained? That's governance. To make sure that anyone who's doing a task, they're doing what they're supposed to do and doing it to the required standard. So they've split this set of rules into two major things. First is that all prescribers should be able to consult properly. Because if you can't consult properly, or you can't have that interview with the patient properly, you won't gather all the information you need to make a prescribing decision. So the first thing is all about the consultation. How do I make sure that I can gather all the information I need from a patient, let's say Adnan or Teja, and then how do I use that information to prescribe? That is all this is saying. Because to prescribe, what you need is you need the patient story. For example, I don't know, tell me last when you were unwell. Give me a case where you were unwell, or anything.
All right, I was sick last week.
Okay.
I was having a chest pain, and
To stop there.
Yeah.
So he's sick, having chest pain. If we just think of chest pain can be caused by heart attack. Chest pain can be caused by a muscle problem. Chest pain could be a result of a pneumonia, like an infection. It could be a blood clot. So we can already see that the word chest pain can be caused by many things. So it's going to be important as a clinician that I gather all the information I need from this patient to find out what could cause that chest pain. That is the consultation. What let's say Ilyas, let's say you were my patient. Okay, what sort of things would you be looking at in me for you to give me the information? Are there certain points that you would say, look, if you were my doctor, you're my prescriber, for me to give you the information, I'd want this in return?
Like if you are more friendly with me, then I can share more the information with you.
Stop right there. He's right. Friendly, meaning building rapport, building trust. And guess what? In the section where it talks about the consultation, in here we have different standards that have to be met. And within these standards, we do have building rapport. How do we build rapport? Is by gaining trust. For example, why do you listen to what I have to say? Okay, it might be like Farouk thinks I'm handsome. I don't think that's the case. That's why he listens to what I have to say. Okay, but it might be because you think actually the reason we listen to you because you apparently are an expert in this area. You have the qualification. You have our trust. So that's the thing. First of all, it's important for him to have trust in me. That am I qualified? Am I regulated? When he knows that, he's going to give me information. So that's one. Okay. So the first thing is going to be building trust with you. In your opinion, what other information or what other, I would say, standards would you expect from me for you to feel comfortable as a patient? So trust is one. So I could be the most nicest guy and get your trust. What else?
And suggesting how to use the medication.
Okay.
After
okay.
Yeah.
Touch it. Any ideas, none from your point of view?
What qualifications do you possess?
Qualifications. Brilliant. So qualifications. Also, he spoke about giving him advice on how to use medicines. So he's talking about communication skills. And communication skills are not just speech. No. A communication skills, and we can define communication skills as a set of procedures or skills that can be learned and improved. For example, the way you stand. And I was telling Ilyas today, when you're in front of camera, how you come across, your body language, where your hands are all communication skills. And for example, let's say I was stood there like this in front of the camera. Totally different body language. Or I'm stood there like this. Totally different communication skills. Or let's say we're speaking to Ilyas and he's busy looking around here. You can see he's giving, straight away he's telling us, I'm not interested. Okay, so even as a clinician, communication skills are very important. How would you feel if I was your clinician, you're talking to me and I'm busy typing? Yes, Ilyas, please tell me what's the problem.
Not interested. Basically, we don't share the information if someone doesn't. It's kind of respect. If you give the respect, we can definitely give the information.
There you go. Okay, what if you're speaking to me and I'm not making eye contact? My head's like this. How does that make you feel? Or I'm looking like this.
Then
What do you say?
Nothing.
Look at this. She's listening. She's not ignoring. She's listening. Correct. Ignoring. So that means that without going into too much depth, the first section of the RPS framework is all about making sure that you can consult properly. That includes making sure that you can gather the information from the patient. Okay, let's turn it around, Ms. Farouk, make it easy for you. So you've got assesses the patient. The first section is all about making sure that you can gather the information from the patient properly. Okay, so you have to gather the information properly. To gather information, you need to have a structure. You need to know how you take a history properly. Okay, for example, what have I explained to you when you speak to any of our Medlearn students? What have I tried to explain to you in terms of following a set procedure?
First, be friendly with the person, those who speak to us.
Yeah.
Then after we can build a relationship.
Correct.
Then after we can like take the information, give the information. That's how we build the trust.
Correct. And he's thinking, why am I holding his hand? Well, let's remove the hand. My point is that I've also given him a set structure to follow. I've explained to him, yes, whenever you speak to any Medlearn student, first of all, gather their details. Find out what their name is. Find out where they live. Try to understand what they need help in. Then you can take things from there. So here again, when you speak with a patient, the first thing is that you need to have a structure. You can't just gather random information. So like, how can I help you today? And then after 5 minutes, let me confirm your name and address. You have to follow a structure. And that's what we call history taking. Okay? That's called history taking. Then what happens is, identify evidence-based treatment options. Okay, let's say you had a headache. And I said, Elias, the treatment for the headache is stand with one leg up and one finger in your nose. That's what will clear your headache. Now, some of you, if I could laughing, my point is that the treatments that we give need to be evidence-based. I don't know why I keep grabbing him. I think I need to stop doing that. The point is that it needs to be evidence-based. The treatment has to be evidence-based. So again, we have to make sure that as prescribers, anything we prescribe is evidence-based. You can't just prescribe because you feel like it. Hey, I feel like giving you Tegretol because you've got, actually it can be used for headaches actually. Anyway, I'm giving you Tegretol because you don't sleep at night. Or whatever, making it up, okay? I'm giving it non-Tegretol because he's wearing his Akuma top, okay? It's not evidence-based, okay? That's the point. So that's the second part. The third part, prescribe, present options, and reach a shared decision. What does that mean? What does that mean to you, reaching a shared decision? What do you think? Anything, what comes to your mind? If we have to make a shared decision, what does that mean?
Depending on health, you might share the medication or age
Okay,
factor.
what comes to your mind if I say shared decision?
So you've explained to me all my options.
Yeah.
And I've come to a conclusion with you that this is the best cause of interest for this
Brilliant,
treatment.
brilliant. For example, Anam, I ask Anam, when do you want to go to lunch? And Anam goes, I want to go to lunch at 2 o'clock. I say, no, you're only going at 3 o'clock. It's not really a shared decision. That's the dictatorship. I will say to Anam, actually, you know what, Teja is going to lunch at 2, it's going to be a bit tricky, and it'd be nice if you turn and look at the camera as well, but apparently she doesn't like to look at the camera, so she's shy as well. You see, all my staff is shy. But the point is that to reach a shared decision, you have to inform the patient, you have to give the patient options, and then together we decide. We decide together, okay, yes, for your headache, I would recommend taking Tegretol. These are the side effects. Okay, if you don't take Tegretol, option 2 might be, for example, this cream. This is the benefits, these are the risks. Tell me what you think, and then together we make a decision. That is on shared decisions. Okay, then you prescribe. Now, to prescribe, you have to follow the law. There's certain things that have to be on the prescription. There's a certain way you have to write a prescription. So that's what it means about prescribing. Okay, then you should provide the information to the patient, of course, because let's say he's got a headache. And what if his symptoms get worse? When he should come back? When should he go to the GP? When should he go to the hospital? So this is all about providing information and then monitoring, reviewing. Monitoring, reviewing. You call your patient up and you ask your patient, how are you getting along? How are things? Have things worked for you? If they haven't worked for you, what we can do? That is on the first section. Now, what I'd like to at this point because Farouk is making funny faces, is probably we're going to do a 2-part series, and this literally just happened as I'm now doing this. We'll make a 2-part series on this. The first part we focus on the consultation. The second part we're going to focus on prescribing governance. Then we're going to talk about the standards, and then we're going to get into the individual standards, what they mean. What does each one by one mean? That's the plan. Folks, while you're watching this video, anybody who's looking for a DPP, wants to develop the clinical skills, or wants to be the best version of themselves, get in touch with Ilyas, okay? And I'm sure he's here for a long time because we're investing in him, okay? He's the man. Get in touch with Ilyas because we are here to make a difference in not only your lives, but the lives that you're connected with. Thank you for watching. Ilyas, do you want to say something?
Yes, please subscribe, like and share with your friends and family, okay?
Perfect, thank you.
When you're ready,
So where's he gone, Majid? Where's he gone? Ilyas, so you can listen. Come on.
Okay, tell me.
So then you can listen.
Catherine के drops हैं just ready करने के. Okay, Catherine Ross's drops.
Bismillahirrahmanirrahim. La ilaha illallah Muhammad Rasulullah. Ready? 1, 2, 3, go. Hey everybody, welcome to this video, and in this video we are going to be talking about the RPS framework.